Slippery, icy spots that anybody can slip on outside. KETK Stacey Spivey right now is live at our News Update Center to tell us about all the ice-related injuries happening in our area.
Yeah, Neil, I've even caught myself slipping several times on the ice today, and the doctors I talked to say that they've seen a lot of ice-related injuries in the past 3 days. East Texas Medical Center has responded to more than 60 fall-related injuries, and a doctor with Trinity Mother Frances says these falls can be extremely dangerous for our seniors.
And I wasn't careful enough.
East Texan Fred Freeman slipped on the ice and hit his head on Monday.
He was going out to our daughter who lives down the driveway, and he just slipped on the ice and fell and hit his head.
Thankfully, Freeman is walking away without any serious injuries. But Dr. Jamie Kirby says the older population could really suffer severely from falls.
Patients that are going to be more at risk for injury are going to be those that are over the age of 50 and definitely over the age of 65.
Doctors say there's been an increase of patients since the ice storm hit East Texas, especially injuries related to falls on the ice. The most common they've seen have been wrist and forearm fractures and tailbone bruises.
When you reach your hands back behind you or in front of you to stop yourself from falling, you're setting yourself up for a wrist fracture.
Dr. Kirby says that even though the ice is slowly melting, everyone is still at risk.
Once that ice thaws and refreezes, a lot of times it's more uneven and lumpy and easier to fall on.
And it's best to stay indoors to prevent any injuries.
Once you're falling, you're already falling, and you're going to injure something.
Just be careful, especially senior citizens.
And ice-related injuries aren't just bad for those that are young at heart, but for everyone of all ages. And coming up at 6, we'll tell you why and how you can stay safe. Reporting live in the News Update Center, Stacey Spivey, KETK News.